Today at the AUA meeting, we have Dr. Barbara Shorter. She is an associate professor of nutrition and the director of the undergraduate nutrition program at Long Island University. She presented her work today at the AUA meeting on the Shorter-Maldwin questionnaire, which she will be telling us a little bit about today.
Hi, I'm really happy to have this opportunity to talk to you about our new questionnaire. This morning I presented the statistical validation of a short-form food sensitivity questionnaire to members of the AUA. And the purpose of the study was to develop and assess an instrument that could be used for clinical practice. And so I have to give you a little bit of history. To begin with, it was in 2007 that we did our first questionnaire that was published in the Journal of Urology, and at that time we had developed a questionnaire with 175 different comestibles, foods and beverages, and we had a number of demographic questions and so forth. And we tested the questionnaire for reliability and so forth, and we were very happy to find that our results indicated that which foods were problematic to most patients. And so we found typical offenders like coffee, tea, alcohol, spicy foods, carbonated beverages, and artificial sweeteners. But the questionnaire was very, very long, and it was about 13 pages, and it took patients a very long time to complete. And we were concerned about the practicality of using something like that. Patients tend to lose interest after the first few pages, and so we were concerned about the drop-off rate. So just moving on a little bit in history, then in 2011, the American Urological Association published their guidelines for the treatment of IC, and they noted that food sensitivities should be a concern for the practitioner, that he should or she should investigate the possible food triggers. And so that was, again, 2011. So that pointed out to us the importance of diet and IC, and so we're very pleased that that statement was made. Now, the questionnaire that we recently developed was, we took the longer questionnaire and we abbreviated it. We took the results from that questionnaire and we finessed it down into a much more patient-friendly form. We took the 35 most offensive trigger foods and the 12 least offensive trigger foods, and we looked at the incidence of IC and food sensitivities, and we also were curious to know how many patients actually ate foods that they knew were bladder triggers. We also were concerned about the fact that people, not concerned, we were curious to know if in fact patients did change their diet once they were diagnosed with IC. So these were some very pertinent bits of information that we felt would be very relevant for patients' charts and for a database for future research material. So we had subjected our questionnaire to all the statistical assessments that were necessary, and we were very pleased to get a full complement of 50 the subjects who completed both questionnaires so that we had a good, strong test reliability. And so we now feel that we have an instrument that practitioners can use as a guide, as a screening tool for IC patients. Now you have to remember that IC patients are very individual in their sensitivities. There are no two people with the same food sensitivities, and there are no two people who are going to have the same exact pain experiences or whatever. Everyone is an individual with IC. There are a lot of comorbidities. There's irritable bowel syndrome and fibromyalgia and the depression and so forth. So every patient has to be treated as an individual. But this questionnaire will give the clinical practitioner an opportunity to get information that can be used to further educate the IC patient. It enhances the fact that diet is an integral part in the treatment algorithm, and so we're hoping that the urologists will use this questionnaire to help the IC patients.